Hello, I am Dr. Girish Nelivigi, Urologist and Andrologist from Nelivigi Urology and Multi-Speciality Hospital in Bellandur, Bangalore. Today, I'll be talking on a common condition called PUJ obstruction. PUJ obstruction is a short form for pelvic-ureteric junction obstruction, which is an obstruction between the kidney and the ureter. Normally, the passage of urine from the kidney is through the ureter and into the urinary bladder. The junction where the kidney meets the ureter sometimes is narrow since birth. This is the level of obstruction, and this obstruction is called PUJ obstruction or pelvic-ureteric junction obstruction. This is a condition which occurs in 1 in 500 babies, and it is present since birth. Normally, the baby will not have any symptoms, but it is usually detected on ultrasound most of the times before birth, and it persists after birth also. If the baby has swelling of the kidney, then a pediatric urologist should evaluate the kidney to see how much is the obstruction and whether leaving the obstruction as it is going to harm the kidney or not. There are some special tests available, like a nuclear medicine scan, which will tell us whether the obstruction is significant or not. If the obstruction is significant, that has to be treated, because if you leave the kidney untreated, then it causes damage to the function of the kidney as the child grows up. The treatment for PUJ obstruction is by surgery, and this surgery is called pyeloplasty. The pyeloplasty can be done either by keyhole technique or by a small 1-inch cut in the flank of the baby. In pyeloplasty, the area or the junction between the kidney and the ureter, which is narrowed, is removed, and the anastomosis or the stitching together of the kidney and the ureter is done, and this will enable the normal passage of urine from the kidney into the ureter and the bladder. The surgery takes about 1.5 to 2 hours, and the baby will be in the hospital for 1 day. The same procedure can be done in the adult also, because many times if the disorder is not detected during childhood, many times adults come to us for the same problem when they develop pain in the flank or on the sides. In adults, it is only done by keyhole technique and not by an open technique. The patient, whether it's a child or an adult, will be in the hospital for a maximum of 24 hours and can go home after that. The pain after surgery is very minimal, and an adult can resume his normal activities within 3 to 4 days after surgery. Therefore, if someone has got PUJ obstruction, they have to be evaluated, and the correction is easy as well as very rewarding. Thank you.